When you start your family at Silver Cross, you are in good company. In fact, more families choose our birthing center than any other hospital in Will County. In 2021, over 3,000 babies were born right here at Silver Cross. But what happens when a baby is born very prematurely or has critical healthcare needs? Without a neonatal intensive care unit in the community, babies in need of highly specialized care must be transported to a level 3 nursery, usually in Chicago. Imagine the stress and worry of being separated from your new baby for any length of time, let alone days or weeks or months.
So in the beginning, it starts with Tom and Michelle getting married in 1990 and immediately trying to have a family. And about a year into it, we realized we were having some difficulty and sought help from fertility specialists. And we went through 5 years of treatment, and we were basically at our last attempt to get pregnant. And then we were going to be faced with other decisions, whether we would adopt or just not have children. And 3 took, and we were told we were pregnant with triplets. And as exciting as that was, it's also scary because you're told you are now high risk. Don't count on anything. We don't know what will happen. And that went on week after week. And at 27 weeks, one of my gestational sacs ruptured at 4 a.m. on a Saturday morning. And we were told when I called my physician to travel to Rush to be seen right away. And we got there and they were like, it certainly has happened. You will be staying in the hospital on bed rest until you become a mom. So after I was hospitalized for only 4 days, they were unable to hold off labor at about 6 p.m. And about 20 minutes later, I gave birth to my triplets by C-section. And they weighed in at 2.1, 2.2, and 2.8. And again, I was told, it's great that they're born, but don't count on anything. So it too, as exciting as it was to give birth, it was terrifying of whether we would bring any of them home. So that journey started, and we needed to travel to Rush daily to see them. And for me, it was a little bit easier because I was on maternity leave from here at Silver Cross. I was actually employed here at Silver. But my husband was a funeral director, and so his schedule was a little bit different. So unfortunately, he didn't get to see them as much as I did. I would usually arrive at the hospital between 8 and 9 a.m. and stay till about 9 or 10 o'clock at night.
At Silver Cross, we want to give babies and families the very best and healthiest start, close to home. That's why in 2020, we began planning for a level 3 neonatal intensive care unit. We saw the need for this service in our community, and we set out to address it. Through the addition of Will County's first and only NICU, we will be able to provide the type of specialized care our tiniest patients need from the moment they're born. And we can keep families together during this challenging time. Not only that, hospitals from surrounding areas will also be able to transfer seriously ill newborns to Silver Cross, so they too can access this level of care, again with the goal of keeping families close to home and their support systems.
Tom and I talked a lot about giving this transformational gift to help get this off the ground here at Silver Cross. We realized that every minute that we could spend with our children in the intensive care unit was a gift. And now I think with this unit coming here, I think, man, would that have been so different? Like my commute would have been 10 minutes. Or maybe for people in the outlying areas of this area, like 20 minutes. I mean, that is 20 minutes more you get to spend with your baby. You know, should something bad happen and that's the only last 20 minutes you get. I remember getting calls in the middle of the night being told that our son Matthew had taken a turn for the worse, and then you're strapped with a 45-minute commute, and will I make it, you know, in time to see my child one more time?
So one of the best experiences we have as maternal fetal medicine specialists is to be able to give moms good news. And one of them is telling them that they don't have to be delivered downtown, that they could be delivered here at Silver Cross. And that is such a huge relief to the family. And it is one of the best things that we can experience, seeing how happy they are, knowing that they can deliver here at Silver Cross.
The Neonatal Intensive Care Unit is specially designed to promote the growth and development of the premature newborn and sick infant. We have quiet space for rest and sleep, private spaces for parents to bond and breastfeed with their babies, and parents will be intimately involved with their baby's care from admission to discharge. Our NICU is modeled after the Ann and Robert H. Lurie Children's Hospital of Chicago's NICU. Our Silver Cross NICU is staffed by Lurie neonatologists. There's a neonatologist available in the hospital 24 hours a day, 7 days a week. They're here to provide care for the newborns and answer questions for the families. But we're not just a team of neonatologists. We're a team of neonatal nurse practitioners, registered nurses, respiratory therapists, pediatric, occupational, physical, and speech therapists, social work, dietitian, and pharmacist, to name a few of the vital care members of this team. However, the most important team members, aside from the baby, are the baby's parents. Our family-centered approach will mean that the whole entire family will be involved in the baby's care. There's a family transition room available for parents to practice caring for their baby in a home-like setting. This is to ensure that parents have the education and support they need to care for their baby independently at home. There are several pieces of technology in our NICU that I'm very excited about. First, the secure web camera that allows families to view their baby when they're away from the hospital. Second, the latest in incubator technology, so we can monitor baby's temperature while they're doing skin to skin. And this incubator also offers a heated mattress pad, which is the only one available currently. Lastly, I'm excited about the central monitoring technology that we're able to monitor baby's heart rate, oxygen levels, and respirations when we're away from the baby's room. We want families to be assured that when they choose Silver Cross, they know that they'll be receiving the best possible care.
Here at Silver Cross, we have a group of physicians known as maternal fetal medicine specialists. They have been trained to take care of moms that are considered high risk. These moms are generally moms with medical conditions such as diabetes, hypertension, lupus, or they may include moms of advanced maternal age, or moms where there is a family history of genetic disorders. We work alongside with the general OBs to provide them care that will result in the best outcome possible. So if you're a high-risk mom, one of the best things you can do is to reach out to a maternal fetal medicine specialist and talk to them and come up with a plan about how to optimize your health before you become pregnant. There are things that can be done before becoming pregnant that can really reduce some of the risks that we do see in pregnancy.
It's quite ironic now because these babies that I talk about in my life are 26 years old and having babies of their own. And it does give me some comfort in knowing that should they ever need the care of a neonatal intensive care unit, it's right here in their backyard too.
Silver Cross has always been committed to offering the highest level of care right in our community. Our Amy, Matthew, and Jay Vana Neonatal Intensive Care Unit at Silver Cross does just that. And our partnership with Lurie Children's Hospital will ensure our tiniest patients get the best care possible, close to home.
So over the last 2 years, with the pandemic and everything people have been dealing with, we've talked a lot about heroes, and I definitely agree that heroes come in the form of our physicians, our nurses, but I think we need to really remember the tiniest of heroes in this story are these babies who are struggling to take every breath, these babies who are struggling to keep their heart beating. It's time we remember them too as our littlest heroes, and let's help them out. Tom and I are so grateful to be able to bring this neonatal intensive care unit service to our community. It truly is what every family deserves. This will offer opportunity for babies to have the best possible start in life. Won't you please consider joining us in funding this need?